Hi guys, this is Dr. D back with another UL self-assessment form 2. Uh, let's discuss first the green portion followed by orange and blue. This is one of the questions related to dementia with Lewy body. In the question they mentioned good days and bad days and significant difficulty in clock drawing. What does good days and bad days means? The question tells you about the fluctuating cognition present in this patient. What does significant difficulty in clock drawing means? It tells about the visuospatial disorientation. You just have to identify the meaning of these terms given in the question. And the patient has slow movements and speech. The diagnosis here is dementia with Lewy body. Next question about selection bias. This topic is very important such that it almost repeats in every NBME. What does ascertainment bias means? Selecting an unrepresentative population. For example, we take elderly population group to measure BP. Okay, we cannot generalize this population to the real world population. Getting my point? BP measurement in hospitalized patients cannot be generalized to normal population. And what does susceptibility bias means? Considering one group is sicker at baseline than the other. These two terms together come under selection bias. Microscopic colitis, usually present in elderly female with history of taking NSAIDs. On biopsy, it does have mononuclear infiltrate. It has two types, type 1 collagenous and type 2 lymphocytic. The main treatment here is avoid inciting agents. Budesonide is used as treatment for refractory cases. Let us discuss the blue portion. Doxorubicin versus trastuzumab. We know both of these cause cardiotoxic. Doxorubicin causes fibrosis and it causes irreversible dilated cardiomyopathy. Trastuzumab, it causes myocardial stenting, which is reversible. This topic is again a very important one because it almost repeats in many NBMEs. In acute gout, avoid NSAIDs in heart failure or anticoagulation, not just in CKD. Use colchicine instead. Preeclampsia with severe features. What is the criteria? BP more than 160-110. Patient is having headache, vision symptoms, epigastric pain, pulmonary edema, liver enzymes more than 2x, upper limit of normal, creatinine more than 1.1, platelets less than 100,000. If any one of these is present, it is considered as preeclampsia with severe features. What if the patient presents with you at the gestational age less than 34 weeks? Try to stabilize the mother. Consider delivery based on maternal and fetal status. If it is more than 34 weeks, consider emergency delivery. Stabilize the mother with MGSO4 plus B and BB control with labetalol. Okay. The next topic is about COPD. 40-year smoking history. Patient presents you with sputum production, progressive dyspnea, clear lungs, normal X-ray. This is a case of COPD. We cannot rule out COPD basing upon the clear lungs given here and normal X-ray. You have to go with the spirometry. This is again a very important topic which almost gets repeated in every NBME. Lung cancer presents with cavitation, squamous cell carcinoma. Don't consider location when another important feature like this is given. In this question, the cavitation is given at the periphery, so don't get confused here. Smoking is a risk factor of squamous cell carcinoma also. It is not just related to small cell carcinoma. These are minor traps that are given in the MVME, and most common overall and most common cancer in non-smokers is adenocarcinoma. It is presented with peripheral solitary nodule, and whereas large cell carcinoma presents with gynecomastia and elevated beta HCG. Intrauterine device can be given to adolescent nulliparous also. Most effective contraception means it is long-acting reversible contraception like IUD, DMPA. These are just the examples. Coming to the orange section, what are the risk factors for uric acid stones? It is chronic diarrhea. Bicarb is lost in the feces. It causes acidification of the urine, increased concentration of urine in hot, dry climate, dehydration. This is a DD between incisional hematoma and intactness of the fascia. In the question, it is given that exploration of the defect after surgery meets resistance at the depth of rectus fascia. This means fascia is intact. Facial descent usually presents with popping sensation. If the patient presents you with anticoagulation history and he is obese and he has increased incisional pain and serosanguinous discharge, think of incisional hematoma. If these risk factors are present, go with this answer. Just try to rule out the options based upon the history given. Cyclophosphamide and NSAIDs cause SIADH. Why urine sodium is more than 40 in this case? Because the answer is simple. In SIADH, the patient is hypervolemic, so the RAS system is suppressed. Therefore, sodium reabsorption reduces and sodium lost in urine is more. Okay. Next, the mother is given with a history of mononucleosis like illness in pregnancy. The fetus born has hepatosplenomegaly, microcephaly, petechiae, and jaundice. The diagnosis here is congenital CMV, cytomegalovirus. This is a DD related to testicular mass. Young man presents with painless testicular mass, progressively enlarging for the past 6 months. It is firm, does not transilluminate. What is the diagnosis? It is testicular cancer. Do ultrasound and tumor markers, radical orchiectomy. Don't do biopsy here as it leads to tumor seeding. And the hematocele usually presents with painful condition. Testicular tumor is painless. Therapeutic lithium level does not rule out the lithium-induced hypothyroidism. It just rules out the lithium toxicity. Okay. Lithium-induced hypothyroidism can also present even when the lithium levels are in the therapeutic range. I don't remember the therapeutic value. I guess it is 0.6 to something like 1.2. Candida intertrigo. On KOH mount, Candida intertrigo presents with budding yeast and pseudohyphae, whereas tinea presents with segmented hyphae. Patient has history of catheterization. Post catheterization, he has pulsatile mass systolic bruit. What is the diagnosis? It is pseudoaneurysm. If the patient has continuous bruit, thrill plus no mass, it is AV fistula. This is a very important topic related to pulmonary hypertension. Patient has long-term history of hypertension. It leads to left ventricular hypertrophy. The blood is pushed back into the lungs. stiff left ventricle, increased left ventricular filling pressure, left atrial enlargement. So this is basically a left heart disease, and it leads to occurrence of this pulmonary venous congestion and pulmonary hypertension. This is just a formula you need to remember, go through it. Thromboangiitis obliterans can present with palpable pulses, whereas PAD, peripheral artery disease, doesn't have palpable pulses. It is usually diagnosed with digital plethysmography. In secondary or central adrenal insufficiency, usually the aldosterone is normal. Not usually, always, because the aldosterone is not under the direct control of central system. Okay. In primary adrenal insufficiency, aldosterone is reduced. This is again an important topic related to contraceptives. IUD and implant has 99% efficacy. Injection has 94%. It is DMPA. Pills has 91%. PINP and urine hydroxyproline is elevated in Paget disease, and also the ALP levels. Viscotolerance syndrome. What is the pathogenesis? Small platelets, cytoskeletal changes in platelet and leukocytes. Treatment is stem cell transplant. This is again an important one. Liver failure. How does we diagnose it? If the patient has signs of hepatic encephalopathy, AST ALT levels more than 1000 and PTINR more than 1.5. Blocked meibomian gland is chalazion and infected meibomian gland is hordeolum. Patient is 8 weeks postpartum, started formula feeding for the baby, and patient has transient heavier bleeding. It signifies about the return of menses, which has to be reassured. Cervical cancer is an AIDS defining illness. It also presents with back pain. Bile leak can present with peritonitis. Dijot syndrome, which usually repeats in many NBMEs. In this UWL self-assessment, they have asked about the pathogenesis. Loss of genes that control embryonic tissue template formation and migration of neural crest cells. Just go through this once. Tissue template formation related to pharyngeal apparatus and secondary heart field. Let's go with the white section. If the aortic valve area is less than 1 centimeter square and the patient is symptomatic, do a referral for valve replacement. For example, the patient has 1.5 centimeter square and the patient is symptomatic, do the same. Most common cause of aortic stenosis in resource-rich countries, it is age-related, versus resource-depleted, it is rheumatic fever. In adolescents, peer behavior is usually the strongest indicator or predictor of adherence and risk-taking behavior. This is a statement related to the condom adherence question. The adolescent age about 17 years presents you in the office. He tells that without using condom, by the help of withdrawal method, we can even prevent pregnancy. In this patient, educating the patient doesn't help because he's already under the influence of his friends. So try to address the cause. Okay. NBME loves this setup. 2 treatments given with similar outcomes and confidence interval crosses null. They are statistically not significant, but one treatment has more adverse effects. Choose the treatment which has less adverse effects, which is safer, cheaper, because efficacy is equivalent. Uric acid stones form due to, as I have already discussed, due to increased concentration of urine and chronic diarrhea, whereas calcium oxalate stones happens, it occurs due to intestinal absorption of oxalate. New sibling born and loss of exclusive parent attention to the new sibling, and the elder one is jealous about the newer born one, and he or she is insecure about that. So the elder one usually tends to show regression or aggression toward the baby, and they usually presents with attention seeking behavior. Management here is spend more one-on-one time with the elder child. So as seen in appendicitis, pain with right hip extension, getting lost in neighborhood is not just specific for Alzheimer's. It can be also seen in other dementias like Parkinson's also. I mean Lewy body dementia. Primitive reflexes seen in FTD, frontotemporal dementia. MRCP is used to identify strictures. This is a case of preeclampsia with severe features. I have discussed this previously. 35 weeks presents with platelets 98,000 and creatinine 1.8, diastolic blood pressure 116. Do immediate delivery, as I have already told you that if the patient presents with more than 34 weeks, go with the delivery. If less than 34, try to stabilize the mother, and delivery basing upon the maternal and fetal status. Never combine isotretinoin and tetracycline. It can lead to intracranial hypertension. Severe nodulocystic acne. The treatment here is isotretinoin. It is teratogenic. What are the prerequisites? There have to be like 2 negative pregnancy tests and monthly pregnancy testing, and also 2 forms of contraception like OCP and condoms. There is no evidence that isotretinoin alone causes depression and suicide. Unilateral painful vesicular rash in 5th trigeminal nerve distribution. What is the diagnosis? Herpes zoster ophthalmicus. It is usually present with like unilaterally, not bilaterally. Facial erythema, papules, pustules on nose and cheeks, and eye redness plus tearing plus foreign body sensation. Ocular rosacea. Bipolar patient on lithium plus fatigue plus weight gain, poor concentration, low libido, depression like symptoms. It appears to be hypothyroidism spectrum. Think of this and obtain TFTs. COPD patient or OSA patient, obstructive sleep apnea patient, comes to the office for elective thoracic or cardiac surgery. This patient is at high pulmonary risk, post-op pulmonary risk. So the main thing you have to do is pre-op physical therapy like inspiratory muscle training. This reduces the incidence of atelectasis, also the incidence of pneumonia, and decreases the length of stay. Antibiotics are not routinely preferred. They are used in case of infection. CPAP is preferred in case of OSA in the post-op period, not pre-op. Risk factors of Candida enterigo, obesity, occlusive clothing, diabetes, HIV, steroid use, heat and humidity. Excuse me. Okay, let's continue. If a medical error occurs, inform patient promptly. Explain what happened in that situation in plain language. Accept responsibility. Apologize the patient. Describe corrective actions that need to be taken, and also how to prevent recurrence. Coarctation of aorta, left ventricular hypertrophy is seen. First and best diagnosis is echocardiography. Sunburn, if it is mild to moderate, the patient presents you with erythema, tenderness. The treatment here is topical calamine, aloe vera, oral NSAIDs, cool compresses. If the patient presents you with severe condition like blisters, hospitalize the patient and give IV fluids and analgesia. Sudden painless monocular blindness lasting for minutes. It is amaurosis fugax. It can lead to CRAO. The main pathogenesis here is cholesterol embolus from ipsilateral ulcerated internal carotid plaque. Do carotid ultrasound. Separation anxiety. The child usually presents with refusing to go to school, excessive distress when the parents leave, cannot separate from parents. 5-year-old can have magical thinking, like incomplete understanding of the death. They talk to dead hamster. They worry about parents dying. This is just a normal developmental behavior. In borderline personality disorder, it can be treated with second generation antipsychotics and mood stabilizers also. Coming to this streptococcus question, group B streptococcus is usually present in less than 3 months, and group A is common in more than 3 months. Overall, the answer is Staph aureus. Malaria question. In Africa, falciparum is more common, and in America, vivax. Use primaquine to eliminate a hepatic hypnozoid phase. Benzos are not used in acute distress in panic disorder. They are used in acute distress in panic disorder. They are not used for definitive treatment. For definitive treatment, you have to go with SSRI. Coming to the HPV question, if the patient presents with genital warts, it is most likely to be 6-11. If the patient presents with skin warts, it is most likely to be 1-4. Nail melanomas or longitudinal melanonychia are usually benign, but they may transform into aggressive melanoma. Allopurinol use morbilliform rash and eosinophilia. The diagnosis here is DRESS. Other causative factors are carbamazepine, lamotrigine, phenytoin, other sulfa drugs. There can be acute cerebellar ataxia following viral illness. Do sonohystrography to look for the uterine pathology of the uterine cavity, a form of USG that infuses saline into the uterine cavity for improved detection of intrauterine pathology. Bed rest, absolute bed rest increases the chance of thromboembolism. If the placenta doesn't come out within 30 minutes of the fetal delivery, it is known as retained placenta. Constitutionally small infant can have normal Apgar scores, neonatal course, and long-term outcome. Most common dermal manifestation of APLA is livedo reticularis. There is increased susceptibility to Listeria, Vibrio valnificus, and Yersinia enterocolitica in hemochromatosis. Painless ulcer seen on penis with history of smoking, HPV, or phimosis. The diagnosis here is penile carcinoma. This question is about medication non-adherence. If the patient has something like a chronic silent illness like hypertension, hyperlipidemia, or osteoporosis, the patient has high chances of medication non-adherence. If the patient has something like a chronic pain or GERD, they usually take medications. This question is about schizophrenia, the prognostic factors. What are the poor prognostic factors? If the patient has early age of onset, male sex, gradual onset with no stressor, whereas acute onset with a stressor is a good prognosis. Glaucoma, peripheral vision loss. If you see this term peripheral vision loss, think of glaucoma. The main difference between chalazion and hordeolum is if there is infection, infected meibomian gland, it is hordeolum. If it is blocked, And the question given is a rubbery nodule. It is chalazion. Substance abuse can cause both mood and psychotic disorder. Lochia can present up to 8 weeks postpartum. Patient has the right to know and not to know the diagnosis. First, you must confirm the preference directly with the patient. DVT in pregnancy. Give low molecular weight heparin. Failure mode and effective analysis. What are the steps that need to be followed? First, form an interdisciplinary team. Then identify what process we are defining. Give process mapping, a flowchart that needs to be like from start to end. Identification of major areas of risks. 5 Eyes are used in root cause analysis. Opioids can cause erectile dysfunction. How? It suppresses GnRH, and this is the pathway. You can understand it. And NSAIDs may reduce testosterone synthesis, but there is compensatory rise in GnRH also. So NSAIDs usually have normal testosterone levels, whereas opioids have decreased testosterone. Entamoeba histolytica. The diagnosis is stool PCR or NAT. Treatment is metronidazole plus intraluminal antibiotic like paramomycin or iodoquinol. Postpartum endometritis, most common cause is E. coli, usually polymicrobial. If they ask specifically, the answer is E. coli. Endometritis means infection of decidua. REM latency is shortened in narcolepsy. It repeats. This topic gets repeated in almost every NBME for sure. Narcolepsy topic. VSD associated with thrill at left lower sternal border. Myelodysplastic syndrome. What is the treatment? Chemotherapy, transfusions for symptomatic cytopenia, hematopoietic stem cell transplantation. Osteosarcoma usually presents with bimodal age group. Ewing sarcoma usually presents with 10 to 15 years. Calcium up to 14 milliequivalent is normal. No treatment is required unless it is symptomatic. Prostate cancer usually presents with peripheral involvement of the prostate gland. BPH involves the central involvement of the prostate gland. Remember it something like see, prostate P, peripheral P. I remembered it like this. Female sexual interest arousal disorder. The patient has decreased libido or interest. Versus female orgasmic disorder, there is delayed orgasm. You need to differentiate with vaginismus also. Vaginismus means there is contraction of the absolute contraction of the vaginal muscle, pelvic floor muscle. Phimosis, the foreskin is not retracted, whereas in paraphimosis, foreskin gets retracted and trapped, and it is a painful and emergency condition. Immediate reduction of the trapped foreskin is required. Okay, thank you.